When it comes to giving birth, most women want to know, how much is it going to hurt and will I be able to cope with the pain? Unfortunately, no one can answer either of these questions with certainty, but what you can do is improve your ability to cope with pain during labour, as well as understand your options for pain relief and their impact on you, your labour and baby. Labour can be painful, so it's important to learn about all the ways that you can relieve the pain. It's also helpful for whoever is going to be with you during your labour to know about the different options, as well as how they can support you. You may wish to discuss with your midwife what's available at the hospital, birth centre or home, so that you can decide what's best for you. Write down your wishes in your birth preferences, but remember that you should keep an open mind. You may find that you want more pain relief than you'd planned, or cope better than you had expected. They will make a huge difference to how you feel during labour. Emotional support, such as encouragement and reassurance from somebody you trust, can really boost your confidence and ability to cope with pain when you need it most. Knowledge is the key in helping you feel in control and remain calm. Understanding that adrenaline works with you to stop or halt and slow your labour when you need it to, such as for the car journey to the hospital. Nobody wants to have a baby on a busy dual carriageway in rush hour traffic. But we do want large quantities of oxytocin, that love hormone, running through your body, enabling you to make the progress your body wants and shorten your labour. Therefore, to reduce the adrenaline running through your body, you need to feel relaxed, calm, and trust in the knowledge that your body will do what it is designed to do. Learn about labour. This can make you feel more in control and less frightened about what's going to happen. If you are less frightened, that means less adrenaline. Talk to your midwife or doctor and ask them questions. Learn how to relax, stay calm and breathe deeply. Keep moving. Your position can make a difference, so try kneeling, walking around or rocking backwards and forwards. Ask your partner to massage you, although you may find that you don't want to be touched. Have a bath. So let's look at the different pain relief options that are available during labour. Lying on your back can make your contractions slower and more painful. Movement, such as rocking, swaying and leaning forwards, maximises your body's ability to give birth, as it helps ease your baby along the birth canal. There is no lasting side effects for you or your baby. However, try not to overdo it. Saving energy is also important. Lying on your side for a while or sitting up supported by lots of pillows can help your body to work really well while you conserve energy. This stands for transcutaneous electrical nerve stimulation. A TENS machine transmits mild electrical impulses to pads on your back. These block pain signals and help your body to produce its own natural painkillers, called endorphins. It also reduces the number of pain signals that are sent to the brain by the spinal cord. Some hospitals have TENS machines, so it's worth inquiring if you think you would like to try one. If not, you can hire a machine, speak to a friend to see if they have one you could borrow, or alternatively you could buy one yourself. TENS has not been shown to be effective during the active phase of labour, when contractions get longer, stronger and more frequent. It's probably most effective during the early stages, when many women experience low back pain. This tends to be the time you are still at home in the early stages of labour, or if you plan to give birth at home. If you're interested in TENS, learn how to use it and have one available from around 37 weeks of your pregnancy. TENS does not eliminate the pain, but can make it more manageable. You can keep moving and it won't directly interfere with your labour. It is non-invasive. There are no known side effects for you or your baby. It doesn't need an anaesthetist, doctor or midwife. It can be used at a home birth and in hospital. You will need someone to help you to position the pads. It may only help in the early stages of labour. It may have to be removed if your baby's heart has to be monitored electronically. You can use TENS before you get into water, but not when you're in the water. It might make it more difficult for your birth partner to massage your back. Some women prefer to avoid the types of pain relief traditionally talked about and choose alternative treatments such as acupuncture, aromatherapy, homeopathy, hypnosis, massage and reflexology. Most of these techniques are not proven to provide effective pain relief. If you'd like to use any of these methods, it's important to discuss them with your midwife or doctor and let them know beforehand. Most hospitals don't offer them for pain relief during labour, so if you want to try any of these techniques, make sure that the practitioner is properly trained and experienced. There is little research proving the effectiveness of these treatments, though lots of women say that they found these techniques useful. Apart from massage and self-hypnosis, you will need a registered practitioner to perform the therapies. Massage or pressure on the lower part of your back can also help reduce levels of stress and ease discomfort. You can also learn self-hypnosis and relaxation techniques for labour. Water can help you relax and make the contractions seem less painful. It also supports you, enabling you to adopt any position. Whilst at home, you can have several baths throughout early labour, and if you are attending the hospital or birthing unit, you can ask to use the bath or use a birth pool if available. The water should be kept at a comfortable and appropriate temperature. You can combine the use of water with other options, such as entonox and massage. Women who labour in water need fewer interventions and are less likely to need other drugs. However, water can sometimes slow down labour, particularly if you get in too early. You won't be able to use TENS, opioid-based analgesia or an epidural while you're in water. When you call the unit to say that you're in labour, this is a good time to identify your wish to use a birthing pool. Please remember that they will not be available if they are already in use. For home births, birthing pools can be hired. This is a mixture of oxygen and nitrous oxide gas. Gas and air won't remove all the pain, but it can help to reduce it and make it more bearable. Many women like it because it's easy to use and they control it themselves. It works by breathing in the gas and air through a mask or mouthpiece, which you hold yourself. The gas takes about 15 to 20 seconds to work, so you breathe it in just as a contraction begins. It works best if you take slow, deep breaths, and the effects wear off very quickly once you stop inhaling. There are no harmful side effects for you or the baby, but it can make you feel lightheaded. Some women also find that it makes them feel sick, sleepy, or unable to concentrate. If this happens, you can stop using it. However, these feelings usually pass rather quickly after your body gets used to it. Entonox can dry your mouth out. Sips of water may be useful. Entonox is available for all births in all birth settings and can be used alongside and in addition to most other forms of pain relief. These are pain-relieving drugs given by injection or a drip. Opioids may help you to relax and get some rest, especially if your early labour has been long and uncomfortable. Most opioids can be given within a short time of your request for pain relief and begin to work within about 20 minutes. Research suggests that if you're already in established labour, these drugs don't appear to slow labour down. They may help you to postpone or avoid having an epidural if you're finding your contractions hard to cope with. It is still possible to use a birth pool or bath during labour, but is not recommended within 2 hours of a single dose of an opioid or whilst you feel drowsy. Protocols vary, so it's good to check with your midwife if you are considering using an opioid drug in labour. Once you've had an opioid, the effects can last for up to 4 hours. You may feel out of control, drowsy and/or detached. If you don't like the sensation, you can't do anything about it until it wears off. You may feel sick. An anti-sickness drug is usually given at the same time to combat this. All opioids transfer through the placenta to the baby and can occasionally make them slow to take their first breath. Opioids may make your baby more reluctant to feed in the first 24 hours. Epidurals numb the nerves that carry the pain impulses from the birth canal to the brain. For most women, it is the most effective method of pain relief, and no additional pain relief should be required. An epidural is only available if you choose to give birth on the labour ward and is administered by an anaesthetist. To have an epidural, You will need to have IV access, which means a cannula will be inserted into a vein in your arm or hand. This is in case drugs or fluids need to be administered quickly. While you lie on your side or sit up in a curled position, an anaesthetist will clean your back with an antiseptic, numb a small area with some local anaesthetic, and then introduce a needle into your back. A very thin tube will be passed through the needle into your back near the nerves that carry pain impulses from the uterus. Drugs are administered through this tube. It takes about 20 minutes to set up and insert the epidural, and another 20 minutes for it to work. It doesn't always work perfectly at first and may need adjusting. After it has been set up, the epidural can be topped up by your midwife, or you may be able to top up the epidural yourself through a machine. You will need to have increased monitoring for your blood pressure. Your contractions and the baby's heart rate may need to be monitored continuously. There are some side effects to be aware of. An epidural may not work well enough to reduce labour pains in 1 in 8 women. An epidural may make your legs feel heavy. Your blood pressure can drop. However, this can be resolved by giving fluids or drugs through the cannula in your arm or hand, which will help to maintain a good blood pressure. Epidurals can prolong the second stage of labour. If you can no longer feel your contractions, the midwife may have to tell you when to push. This increases the risk of forceps or a ventouse being needed to help deliver the baby's head, known as an instrumental delivery. When you have an epidural, your midwife or doctor will wait longer for the baby's head to come down before you start pushing. This reduces the chance that you will need an instrumental delivery. Sometimes, less anaesthetic is recommended towards the end, so that the effect wears off slightly and you can push the baby out naturally. You may find it difficult to pass urine as a result of the epidural removing sensation. Plus, if your legs are heavy, you will be unable to walk to the toilet. Therefore, it may be advised that a small tube called a catheter be put into your bladder to help you, as it is important to keep your bladder empty during labour. About 1 in 100 women gets a headache after an epidural. If this happens, it can be treated. Some low-dose epidurals now contain less anaesthetic, but include a small amount of fentanyl, an opioid drug. The fentanyl makes the epidural really effective without taking away all of your mobility. But the fentanyl might cross the placenta and make babies sleepy. Studies have identified different feeding behaviours in babies born after low-dose epidurals were used. Your back might be a bit sore for a day or two, but epidurals don't generally cause long-term back problems. About 1 in 2,000 women feel tingles or pins and needles down one leg after having a baby. This is more likely to be the result of childbirth itself rather than the epidural. The type of pain relief you choose is your choice. You may wish to visit NHS Choice's website, discuss this with your midwife, or look at the information in your handheld notes. Do what feels best for you. Every labour is different, and each woman should choose whatever she needs to help her cope with the pain of labour. Most importantly, have confidence that you can do it.